And so that under background information was a new piece of information that we just received this week. And we will add in the final report, there is a reference from the National Vital Statistics System from that data source. And there was an article in the Star and Tribune this week on that. So we added that. Then moving through, we clarified that many of the municipalities do not have a lot of prominent information on their websites. And so we clarified that under number 1. And we also clarified under number 2, I'm under background information, that there's only one bin that's actually available between the CVS and the Walgreens over on York Avenue. And the third site is at Fairview, and that there's no disposal site that is west of France or north of 62. And so that has been added. And the third item, we added the information from a conversation with our Edina police do offer disposal bags. And we added information that in 2012, it was reported to us that only 12 disposal bags had been handed out by the public. So it's something that people really don't know about, which is part of the whole focus of these recommendations. And then going to number 4, we also clarified that medications can be disposed of through disposal bags at home and simply putting it in the trash. And that, let's see, with that, those are really the changes under background information. Are there any questions just under background before I go on? Okay. If you have any other ones, we'll keep on going. So then under recommendations, the website enhancement is pretty much what we've said before. And to get more publicity is under number 2. We highlighted like an opiate icon. And then under number 3, we highlighted the fact that medication disposal is the measure, and that and then under number 3, 3B, and this really keyed into a lot of the comments that we had last time, that the medication disposal needs to be really strengthened and encouraged from people's homes, and that there be medication disposal bags that are made available to each household in the city of Edina, especially given the fact that there's so much that's happening from people's homes. And so that is a recommendation that that we are including there, really keying off of the recommendations from our commission meeting last week. And then that the disposal bins be expanded to from 4 to 5. And then that really concludes. So that's the big addition, I would say. So that really concludes the recommendations that we would ask to be sent to our council. And comments from you all. Greg, do you have any other comments? Did I miss something?
I don't think so, but just so that people know, the red is really what Mary and I were using to bounce back and forth. But we do have a final copy that took care of a couple of typos, that added in the reference number 4 within the text and changed the red markings to black. So it looks a little more staid. But in terms of content, I have nothing to add.
Do you think it would be worthwhile to remind people through this report to please not flush them? Because I guarantee you there are those around us that don't pay attention to such things, and they'll flush them anyway, thinking they're not doing any real harm. Is that something, I know it's just one little point, but is that something we might want to help reiterate? considering.
So,
Just asking. Go ahead.
yeah, so Phil, so underneath number 1, which is the web enhancement, there's a lot of little pieces of information related to this that need to go onto that website related to safe storage, opiates, emphasize the importance of prompt disposal, especially opiates. So there's a lot of information that will need to go onto that website. That would be one of them. Another one would be when you're, and so that's where, rather than getting into all of those little details, such as that, that's where that would rest. Another one is that when people are putting medications, I'll give you another example, into the disposal bags, that you're going to want to take those original prescription containers and dispose of them also. But that information would fall under that number 1 in terms of the web enhancement and information.
Okay, thank you.
And Greg, did you have any other comment on that? In
Well,
terms of all those details.
Philip, you're entirely right, but our thought was that both in the website enhancement and in the publicity, the publications sent out to residents, that the appropriate people in the city would need to develop specific content, and rather than outline all of the content, the feeling was turn it over to the city saying you need to have good content, and then they can work with the appropriate experts to create good content, both to put on the website and to put in articles periodically in the various things that the city sends out.
Does that make sense, Jeff? From your angle?
Yeah, it makes, I mean, yeah, it makes sense.
Okay.
I have a question. Do we know how much, or maybe we could even reach out to Bloomington to see, if their public health has anything kind of at the ready for us to kind of piggyback off of or use? I don't know how, with that relationship, if that's something that we could do.
Yeah.
Greg, you wanted to cover that one?
Well, the answer is Bloomington is like so many other places. There's little information. It's difficult to find, and there's really nothing to piggyback off of. I know I didn't, but I think, Mary, was it you who spoke with somebody at Bloomington?
Yeah, we had received an email. We reached out to Bloomington thinking that they would just have the package in some of their areas, and they really did not. They did not have a lot of resources. They really just linked into Hennepin County. Now that may have changed in the last month or two, but this is an evolving, topic. So we'll just have to, kind of piece that together. But even in the development of it, we'll have to, connect with whatever would be available we could lean on easily.
I think Mary and I were both struck by the discordance between the severity of the problem and the accessibility of any kind of information throughout the Twin Cities area.
Mm-hmm. And then even looping back in with what Philip was just saying, that one of the key reasons, or one of the reasons in terms of the recommendation to make a disposal bag available to each household is for households to know that it is to be disposed of using, in that proper bag, and then it goes into the trash so that it does not go into our sewer system. And that can just be very easily part of that. The part about it is that it's very difficult to find places, and nobody's really using the bags. 12 people used it in 2021 out of a lot, in Edina that we're aware of, that we were told.
I was going to say, Mary, just like what you said and what some other people, I think that Philip had mentioned, and I remember a while back, and I actually just looked it up just to confirm, because I was like, in my head, I was like, that can't be right. Like one of the places that actually has more like some of the most helpful information about disposal is actually like the Minnesota Pollution Control Agency.
Right.
Yep.
Which I, again, in my head, I was like, that's not right. It's like, that wouldn't be related to health, but
Oh yeah.
So I think that, that's just it is, the flushing of them equals they end up in our lakes and rivers and everything, which, has other environmental impacts. But I think that kind of just goes to underscore a point that you made. And again, how we address it, I think is, something to continue to discuss, is there's just so many different sources of information on this from so many completely different places that really, I mean, some of them you'd be surprised, I guess it's surprising when they don't interact more often than they do, but then there's other ones where for that, I would never actually expect a pollution control agency to interact with, like some of these other groups. So I think whatever we can do to steer people in the right direction is helpful.
Mhm.
The ironic thing is that the information on the MPC site was probably amongst the best that we found, but it was hard to find.
Mhm.
A question and maybe a comment. This is wonderful, wonderful work. It seems that it's let's just start with the bags. It's hard to get the bag. And when you do get the bag, does it have instructions or a QR code on there?
Yes.
For the procedure, pardon me?
Yeah, it comes with printed instructions.
Okay. Would the drop-off sites are those on the bag?
No, because the bags are, built by nationwide companies. So, so the instructions are on the bags, but people need better to understand that they also have bins available. And then, of course, we propose that there be more bins spread more uniformly throughout the city instead of having 3 in the southwest or southeast corner of the city.
But with the bag, you can dispose the bag in your weekly trash, correct?
Right.
Yep.
Okay.
There would be an opportunity, Mike, to for the city to look at the bags, the current bags, in terms of what's on them, if we have this opioid icon, and if there would be additional information. So this project could look at something different with the bags. There might be a cost with that. So we have not gotten specific here because right now there's such low hanging fruit just to get the bags out to people with some instructions about what to do. We think would just be a huge, step forward, even that. But there would be certainly an opportunity to be able to enhance, that information and what to do and all that kind of stuff.
Right. May I bring up a point of privilege? My wife of more than 46 years has prepared a special Valentine's dinner, not remembering that we have this meeting. And if I'm not at the dinner table at 7 o'clock, this is the last time you will ever see me. So I'm going to sign out then. But Mary is doing such a good job of discussing this. I feel very confident in her.
Happy Valentine's Day.
Okay, thank you.
Have a great dinner.
Okay.
Other comments?
I think it looks great, and you did a great job, and I really appreciate all the work that you two have done.
Thank you.
This also seems kind of timely with the opioid settlement. Does Edina know how much money it's getting?
Mhm.
I don't know off the top of my head.
Okay,
I'd have to look back.
Mhm.
fine, but it seems like great timing.
Yeah, it does. I agree. One of the things I think that was really helpful was when we brought last month's report here to this group, because we were able to get so many great ideas that we were then able to really help to fine tune what was in this report. And I think the piece that we think will have the most impact will be the expansion of the disposal bags. Huge impact, just that. And then, of course, expanding the bins. And then with the settlement coming, it's a really nice proposal that we can say, here's something that our city can do related to this. And then even the new information related to teenagers that was reported in the newspaper this week, that connects with the 4th recommendation regarding the Board of Education to include more information related to opioids in classes. So the two are they really can synergize just right now. So
I'm really sorry, like the last thing for me on this, but I was gonna say, like, not knowing how much money is
Yeah.
coming into the city for that. But just in terms of, how this does get out and, just trying to figure out, some of these areas where things might not connect as simply as they should in terms of pollution control and health. But I mean, would there seems like there would even be the, like, and Jeff, just shake your head no if this is like ridiculous to even, float as a potential idea, but like something where like the bags can just be attached, just through like an initiative in the city to the, garbage cans, when they're returned. I mean, I don't think that's outside of what we see for, even like the tip things that get stuck onto them, on the holidays. It makes it as easy as possible, lowers the barrier for tipping, making sure that they know they're appreciated. I mean, to the same extent, if we could do something, if there's like a possibility to do something like that at a reasonable cost, I mean, that connects the bags directly to where they're supposed to end up in the first place and make sure that they're at every single house.
Mhm.
Andrew, I think you bring up a good point, depending upon the money. And we do a lot of direct mailers. And instead of maybe on the garbage cans, you could, there's services that you could include that in the mail. For every Edina household, we get a bag, for example. And then we could take and develop down the road a QR code specific for Edina. Because I think this thing's going to keep evolving, getting better. But like I said, depending upon the money, you could do a direct mailer where every household gets one bag.
Yeah, there's a lot of options for distribution. We have different lists that we use for different things, and we can do that. We can do the mail. Sometimes it's harder with multifamily buildings to do mailings, and so there's that component too. But yeah, we can. There's a lot of ways we get things in residents' hands. You all probably receive things from the city, and whether you like it or not. So, but yeah, we'd have to. I think the beginning thing would be the supply of the bags, like how many can we get for how much, and how soon, and then kind of an initiative to do that initial mailing, and then I think Mary's right, like the ongoing availability of them at a place that's easy is and the increased awareness is probably the best low hanging fruit, I guess, that has been discussed. So I think that's something that we can work on and make happen. We just have to get a plan together and execute it.
Is there a way to impress upon the folks to maybe put this into that Edina newsletter that goes out, I think, once a month? It's a big thing with information, news from the city. It's impossible to find out if we can get the news about this in there somewhere.
Definitely. I think if it goes for, when the recommendation goes to council and council maybe gives direction to staff, excuse me, that would definitely be part of the outreach.
And that would be included in the under publicity item, what is it, B? Occasional articles, that kind of thing.
Mary, really quickly, I just was going to say I'd be remiss if I didn't I should have started here before. I keep jumping ahead to how to implement some of your recommendations, just to say thanks to you and Greg and everybody else for the amazing work on this. So apologies that I didn't lead off with that.
Yeah. And I think we talked about this one other time, but I'd also recommend on the publicity side or whatever that we start looking at places where people are naturally going to start asking questions about where they can turn opioids in. I think we talked about hospice before, doctor's offices, those kinds of things. I think it'll be really important because that's typically where people will go for information like that.
Sky's the limit here, you guys.
Yeah, exactly.
A lot of different ideas. I know we had to keep on limiting ourselves to say, okay, these are a set of recommendations, and you can just keep going.
Yep. No, it is really good work. Thank you.
Can I make a motion that we approve this with and then there's like a typo, and then I'm going to add this reference under number 4 for approval from our health commission, or should somebody else do that?
I think you're allowed.
Okay.
I'll second it.
Okay, great. Anybody opposed? Nope, everybody's in favor. Aye?
Aye.
Aye.
Right. Passed.
Thank you.
Thank you. Great job. Jeff, I'm going to ask you to go back to the agenda because I don't, other
Getting
than
there.
our comments and your comments,
Yep, basically.
any member comments? I have none at this point.
Just want to say thank you to Julie for being a great chair. It's been my privilege to work with you.
Well, thank you. I don't really feel like I've done anything. It's just been kind of a whirlwind.
I actually had a question. I have a friend who's on a different commission and they're losing some members. Are we losing members and gaining new members right now? No?
No, we are
Okay,
not. We will, well, wait a minute. I would have to look. I don't believe we are,
okay.
but new member time is like March-ish. So, board and commission applications and are reviewed and then new members start. So,
Is Greg? He might be the only person.
oh, I don't know.
Or
Let me
did
see here.
Or did he just? was
Did
here
your
last
screen
year?
just change or are you still seeing the agenda?
I'm still seeing the agenda.
Okay, good. Then I can look, try and look this
It's
up.
It's 3
Well,
years.
3 years.
Mm-hmm.
Yeah,
I feel like we had a big turnover right before COVID.
we kind of did.
Yeah,
So this group has been here for 2 years, correct?
pretty much.
I think
Okay.
so.
I'm one.
And those of us who have asked to stay on another year, that's already been taken care of, or are we still awaiting news on that?
I think that's taken care of.
Thanks.
Let me attendance. You still see the agenda? Okay.
Yes.
'Cause I'm doing something else and I can't see it anymore. So I'm trying to look stuff up. Okay, so yeah, nobody's done until 23. And so they've got it's broken down. So expirations are in groups of 3. So in 23, it's, well, Amanda, who's resigned, so she's not here, her spot. So we might be getting a replacement for her. And then it's Rob and Michael in 23. Then 24 is Mary, Tracy, Julia. And 25 is Philip, Greg, Andrew. And then student members are annual. So that's where we're at. And I should be putting this attendance sheet in the agenda, in the packet each month, but I don't. So I'm going to try to start doing that.
Great questions. Anything else? Okay. If last chance, and then I'm gonna, not last chance, but I'm gonna transition it to Jeff for staff comments unless there's anybody else. Okay, Jeff?
I guess not a lot. COVID numbers are still decreasing from our, I guess, meeting this morning. The rates in Edina are lower now than they were in November of 2020, which was the previous highest peak before this peak. if that makes sense. And somebody made an interesting observation that you've probably all heard the wastewater sampling that's happening. It's kind of a predictor of case rates like a week ahead, and that still shows a decline. Like it's still declining. So hopefully next week and in subsequent weeks we still are having declining rates. And those are just the officially reported ones. That's not at-home tests and things like that. So obviously there are caveats, but it seems like we are having a good rate of decline. And related to that, we are likely to be meeting in person in March. I guess not the virtual meeting agreement, I guess, by council expires at the end of February. So unless they extend it, which I don't believe they will, we will be meeting in person in March. I guess I'd kind of like to hear people's thoughts about the idea is to try to meet in a space that's big and has room. And for us, that would likely be Public Works, where we've been in the past. The only other option would be to meet in the community room, which is smaller. And maybe some of you have never been in, but in that room. So I don't know if anyone has thoughts on that, but we're likely to be meeting at Public Works. So kind of the same setup as we had for 2 or 3 meetings there. That's kind of the main stuff. Or go ahead, whoever.
Yeah, it's Mike. If we met in the community room, is there an opportunity to do a hybrid there in the community room?
Once we
'Cause I
go
don't think
back, we have to just go back. There's no hybrid.
Okay.
It's by rule. It's not a
Oh,
technology thing. It's
okay.
you're not allowed.
I mean,
So
you are, but don't you have to open up your house to members of the public that would like
kind
to?
of. It's like
present?
you could do it, but like because you're like officials, people have to be able to be where you are. Like you have to be public. So like if you went to Caribou, we'd have to post Mike's at Caribou. So if you want to come and give community comment, he's at table 4 over here. So we're basically not doing that. So we're kind of if we're going virtual, we're virtual, and if we're not, we're going back in person, but we're going to try to accommodate with some spacing and stuff like we've done at Public Works. I mean, I know the flexibility of being virtual is great because sometimes, you can't make it otherwise, but we're likely headed back in person.
Jeff, this is Mary. Who makes that decision?
That's a council decision.
Hmm.
So it's basically recommendation by staff, and then, they just take in all the information of what's happening, what the current CDC recommendations are, the MDH recommendations, what does staff think, and they kind of mull it all over and make a decision.
Well, I think it's too bad that a hybrid is not an option or whatever. It seems like that is just not keeping in sync with what meetings are happening these days, where people are doing both, really, for flexibility, for any number of things.
Yeah, the hybrid idea, I mean, I think it's great. It's the legality of open meetings is what I think the legal open meeting rules didn't have hybrid meetings in thought, I guess, when they got passed. So maybe we'll catch up eventually and have some kind of accommodation for that. We just don't right now.
Jeff, just to clarify too, can't members of the public still participate remotely, and then we can still meet in our work groups as long as it's not a quorum of the larger body, in kind of whatever capacity is the most manageable?
You mean like could members of the public call in?
Yeah.
We've done that in the past in certain meetings. We're basically not doing it for these now. But yes, the working groups or subcommittees as long as we don't have a quorum, you know, you can meet anytime, wherever. So that's a good option. That's part of why it's good for us to have our smaller groups, to do that work, I guess, outside of this meeting. So, but otherwise, my staff is just kind of doing their regular stuff. Our COVID work is kind of getting less. It's more routine, I guess. We did have a influx of masks. We got 18,000 KN95 masks distributed to us as a community health board by the state. And so we did a kind of a mass distribution to a few different locations in the city. Not the mandate, that's a bad word. The suggestions or requirements for when we received them was to try to get them in the hands of people that may not be able to get them on their own, or, you know, didn't have resources to get high quality face coverings. So we did kind of a, I guess, targeted distribution. So we did, because of our licensing and inspection system program with restaurants, we brought bags of masks to all of our licensed facilities to distribute to their staff, because restaurants are potentially a high risk environment, people being close, working in close proximity. So we did that. We did distribute boxes to Common Bond, our affordable housing complexes. We have 3 buildings in town. Also to Beacon on 66th, the I guess young adult facility there. Some to the Southdale Library, so they could hand out to guests there. Some to the senior center, and then kind of the remaining we gave to Park and Rec to distribute at our various public facilities, Edinburgh, the arena, I guess the golf course clubhouse got some, but there's not a lot going on there right now. And then the liquor stores, because people go into the liquor stores. So we've handed those out for distribution at some different places around town. So that's where those went. It was kind of a neat initiative. Our two of my staff basically got in a car and drove around and dropped them off to all of our licensed food places in a few days. So they were kind of a tag team there. But otherwise, stuff's going pretty well. Yeah, no other major, I guess, things happening. That's what I got.
I like that you were able to distribute them to restaurants. That's great. Especially since a lot of the workers do not necessarily have the funds to get their own. Anything else? Well, hopefully people can't hear Netflix going on in the background over here. Okay, well,
I'll move to adjourn.
we get a second.
Second.
All right. On that note, everybody go have a great rest of your Valentine's Day.
Wild.
Go well.
Right? I was
Yeah.
like, thanks, hon. I'll stay at home and watch the kids, and you can go to a hockey game. Great.
Right. Catch up on your sleep.
Exactly. It all works out. It's fun. Okay, well, great. Thank you, everybody, and
Bye,
have a
everyone.
good month, and we'll see you in March.
Bye.
Right.
All right.
Bye.